The Affordable Care Act versus the proposed American Health Care Act. Neither of those acts address the real problem with health insurance. The real problem is that the United States pays 18% of its GNP for health care, and the rest of similarly situated countries pay 10% of their GNP. Plus, the American GNP is a lot larger, and that is the real problem. Neither of those acts address that problem. To go over now what the difference is between the two, you have to look at what insurance is. Insurance is when people pool their money together and they are able to afford paying for disasters which would wipe out any of them if they didn't have it. So, by definition, insurance has winners and losers. With regards to the proposed American Health Care Act, you have to look at what really insurance does. It's the premiums plus the subsidy plus the investment of the money that the insurance company holds before it pays out, minus the gross amount paid to healthcare providers, minus the deductibles paid. That equals the operating expenses of the insurance company plus the insurance company's profit. In our system, people do not provide insurance unless there is a profit. Then there are a couple of facts that you have to take into account. One of the facts is that poor people are sicker in general than people who aren't poor. And the reason for that is that poor people are not able to generally do jobs. If you're sick and you can't come into work, generally after a while your employer will not put up with it and fire you. Another thing is, in the proposed American Health Care Act, subsidies are going down. That's a numerical fact. Then the premiums and deductibles under the American Health Care Act are going up. And another thing, under the Obamacare, companies are getting out of the business. The only reason they're getting out of the business is profits are not high enough. So if you look at the equation and you look at the subsidies are going down, so that only leaves premiums and deductibles to go up. One of the lies of the American Care Act was that you can keep your plan and your doctor. They did not say the part as you can keep your plan and doctor as long as your plan is as thorough as required by the AHCA and your doctor is in a plan that you choose. So that was the lies of the AHCA. The untruth about the American Health Care Act is that it's true that you will have more choices, but one of those choices will be to not have insurance. The other choice will be to have a higher premium or a higher deductible, and that may result in your doctor choosing not to treat you. Neither of those acts deal with the real problem, which is that medical costs are too high, and neither of them will be a solution to that problem.